like that. And welcome everyone to another wonderful episode here at Doctors of Podiatry. Today we are going to go ahead and do like a little interactive video testimonial. We have a patient here who, when was it again? The last, the procedure?
A week ago.
Oh, that's it?
Yeah.
So a week ago, this patient presented with a very, it wasn't like a huge interdigital corn. There was definitely some a palpable bony prominence, which at night. So tell your story. Go ahead. He's okay.
Well, during the day was okay, but at night I had to wake up. Of course, it was at 2 a.m. or 4 a.m. in the morning because I have some shooting pain or something on my pinky toe.
And you said it was only sort of like it was at night, right?
Only in the middle of the night. Yeah, not during the day. Middle of the night. Yeah.
And so the patient, he got here. We got some X-rays. We saw that the X-rays, even though there was no visible like corn visible. IPK, like a seated corn or a callus, there wasn't really anything visible per se. But the X-rays, not only did I see that little spur there, but it was more palpable when I pressed on the right in between the two toes on the fifth toe. We can clearly see feel that prominence, which is kind of interesting because it was only happening at night.
At night, and the other thing is I bought some what they call extra wide shoebox.
Yes.
So I bought some new shoes for that, and it helped a lot on the outside of the pinky toe.
But not on the inside.
The inside, it was a bone spur.
Right. So he was telling me that. I asked him the last time he was here. I said, "Well, what about pain medications?" He said that you didn't take.
No, I didn't take any pain medication.
Not only no pain medications, but not even Tylenol.
No.
Which is kind of it's interesting. Today we removed the suture. Okay, that's what it looks like. And there is a little bit of residual swelling, which is completely normal. Aside from that,
everything went fine. After the surgery, no medication, no Tylenol, no nothing. No pain, no nothing. Everything was fine, yeah.
And it's interesting because, the wife just basically said, he hasn't had any pain at night. So, again, at the core, we fixed the problem, which is how can something so small cause so much discomfort, right? That's what you sort of ask yourself. And, what we basically did was just shave down that little bone using, our minimally invasive techniques. And you're doing great after a week.
After a week, yeah. The only problem, my wife did not follow the doctor recommendation that I could not cook for 6 months, but I still cook. So, that's the only problem.
I really did say that. Now, this is these minimally invasive procedures are really great for a lot of reasons. I like when we have individuals as such that really just carve out a little bit of time just to do this. I like when it always comes from the patient, not from me, just for me to say, oh, the patient's doing great. This is obviously, everyone knows that this is not something that we planned. I just basically said, hey, do you mind if we do a little video testimonial? He agreed, take out the camera, and then we just, we do this little segment, which I think a lot of people appreciate for a lot of reasons. A lot of people wonder, right?
Oh, if I can help other people with my issue I had for a full year, in the middle of the night, yeah, of course.
So, he's a great sport, great personality. He's definitely, he's a comic, I think, deep down, always cracking jokes. Like always, if anyone has any questions in respect to anything in what we do here at Jaws Podiatry, you know where to find us. Like always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry Facebook, and last but not least, our YouTube channel, Jaws Healthcare. I want to take this opportunity to thank the patient.
My pleasure.
Thanking the patient for carving a little time to do this, which I think will, if it can help one person, right?
Yeah.
I will be
Too, you helped me too.
exactly.
My life is better now.
You
He's
know,
more patient.
you know the saying, "Happy wife, happy life." So there you have it, right?
Exactly.
If we can help, 1, 2, 3 people, that's, to me, that's really important. So we will continue to educate the world one toe at a time. That's what we say here. So like always, have a wonderful and safe weekend.